Good morning, everybody. To 8 p.m. last night, we had more than 98,000 people come forward to get tested. Not only is that close, obviously, to 100,000 tests, but on a weekend, I just want to thank everybody for taking the effort and time and responsibility to do that. We had 145 cases of community transmission to 8 p.m. yesterday. 51 of these, unfortunately, were infectious in the community during that time. Can I stress again that it's really important for people not to leave home unless they absolutely have to, and in particular, do not mingle, do not have any exposure outside of your household with other households. We're still seeing that as a challenge, and especially as we've seen at a time of bereavement, we can't allow exceptions at this point. We don't want any setbacks, and we need to make sure that everybody appreciates how important it is not to mingle between households and to stay within your household. Can I also please ask that if you do need to work, you're recognised as an authorised worker, or you do need to work, that you please make sure that you adhere to all the COVID safety plans, whether it's wearing a mask, good hand hygiene, social distancing, all the other measures that are in place. Because every time any of us step foot outside our house, we have to assume that we have the virus, or anybody that we're remotely coming into contact with has the virus. Can I also please stress how important it is for everybody to get vaccinated? Please come forward and get vaccinated. Dr. Chant will talk about this as well, but especially in those southwestern Sydney suburbs and western Sydney areas, we now have additional clinics. We've got pharmacists that are online, your GPs. It's really, really important for people to get vaccinated. Not only does the vaccine assist in keeping you out of hospital, but it also helps protect your loved ones, because we know that the vaccine helps in reducing how contagious people are. So obviously lockdown, restrictions and vaccines, a combination of those things, will help us live freely until the large proportion of our population is vaccinated. And that's the challenge for us, is to make sure that not only do we have the lockdowns and the restrictions in place at the appropriate time in the appropriate way, but also that more and more people are coming forward to get vaccinated. I welcome the revised health advice, which now says that all adults can get either vaccine. So please come forward and get vaccinated, even if it's the first dose. It's critical as part of our ongoing strategy, in addition to the restrictions, to make that happen. As I've said previously, this week, today and the next few days, on the back of health advice, but also in consultation with all of our officials, we'll be making decisions about what life looks like beyond July 31 in New South Wales. And so we hope to provide announcements or updates to the community in the next few days. And I say to the community, please be assured that our mission is to keep the community as safe as possible, but also to make sure we allow the community to live as freely as we can as well. And there's no doubt that some restrictions have better effect than others, and that is the advice we'll get from our health experts, as well as obviously in consultation with other officials. And I look forward to providing information on that in the next few days. Finally, before I hand over to Dr. Chant, I really want to thank the community of the Fairfield local government area. In the last few days, we've seen a reduction in the cases that council area has had. We also know that they're the least mobile in all of New South Wales. They've actually been doing the right thing, and now we know there's greater risk in the Canterbury-Bankstown area, in those suburbs. So we ask residents in the Canterbury-Bankstown area, in Liverpool, in the Cumberland local government area, to be extra careful and please abide by the rules. But again, a huge shout out to the people of the suburbs within the Fairfield local government area. We've seen an improvement there in the number of cases and the number of infections, and we need to see those results similarly in Canterbury-Bankstown. We don't want the spread to increase, quite the opposite. So if you live in those suburbs and areas that Dr. Chant will highlight, please make sure that you respect the health advice and respect the settings. Dr. Chant will now give her update. Commissioner Fuller will make comment, and then we'll take your questions. Thank you.
Thank you, Premier. So New South Wales recorded 145 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. And yesterday we reported 2 deaths, which have been included in today's numbers. Sadly, we're still seeing a large number of cases infectious in the community, 58 cases, and 25 were for part of their infectious period. And this highlights that even as you're moving about, assume that you could be in contact with someone who has COVID. So please make sure you're wearing your mask appropriately and you're staying your distance, at least 1.5 metres away from everyone. It is also important that we maintain that testing, and it's so pleasing to see 98,158 tests. So I think we've seen almost that 100,000 mark met over a number of days. I'd like to give two key messages. We are seeing that the transmissions at the moment are being driven by two factors. One is ongoing contact between households. And can I just express my deep understanding of how it is so important, people's extended families and friends. But at this time, when we're responding to such a crisis, it's really important that people only stay within their household unit and don't have any mixing between households. We've also, the other key message would be about vaccination. If we are to, as the Premier had said, the future is driven by our vaccination coverage. And clearly the vaccines have twofold protection. Firstly, they provide, if you're vaccinated, they protect you, but they also have an impact on protecting others. So if you're infected and you're vaccinated, you're less likely to pass it on to others. So at this point in time, while vaccinations are not the whole answer at the moment, and we need to maintain the lockdown as tight as possible, vaccination is part of the answer. And so I would urge everyone in the community to please come forward and get vaccinated. There are a number of pharmacies in southwestern Sydney that will be able to administer AstraZeneca today. And these pharmacies will be listed on our website, highlighting where to get the vaccines. And just to message, there's some at Bankstown, Bass Hill, Cabramatta, Carnes Hill, Casula, Liverpool, Greenacre, Fairfield, Panania, and a vast array of suburbs. And we see that pharmacy access to the vaccine will support the local community. So please, AstraZeneca will be available through these pharmacies, and I urge everyone today to go onto the website and find their local pharmacy that's got access to the vaccine and go forward and talk to their pharmacist about getting vaccinated. In terms of the areas that we want to call out, we're calling out a number of areas for increased testing. So on the North Coast, we're still interested in having high rates of testing around Coffs Harbour, Byron and Ballina. In Southern Highlands, Mossvale, we've had a couple of low sewage detections in Mossvale, and we don't have an obvious source there, so we're very watchful. We are doing daily sewage to investigate that. Again, keep that testing up in Orange, but it's been pleasing so far that we've seen no ongoing transmission. And in Western Sydney, Cumberland, local government areas, in particular Marylands and Guildford, Tuangabi, Pendle Hill, Mount Druitt, Rooty Hill and Blacktown and Western Sydney in general. There's also the Inner West and some areas in southwestern Sydney. Per our messaging, we need to continue to see those high rates of testing. Just wanted to also mention that we are responding to an infectious healthcare worker who was at Liverpool Hospital, and that person worked whilst infectious. The district is working promptly to support urgent patient testing, and updates will be provided later in the day. Thank you.
Morning, Premier. Morning, ladies and gents. 227 tickets issued overnight for breaches of the health orders, 107 of those linked back specifically to the protest on Saturday. So backing out those tickets, can I thank the community, because we are seeing an increase in compliance across particularly Sydney metro area and those beach area with the health orders, so we thank you for working with us. We've received some 10,000 Crime Stoppers reports since Saturday in terms of criminal behaviour and breaches of the health order at the protest, which is an amazing outcry by the community, not just in terms of their disgust at the protest, but the way that the police, the Mountain Unit particularly, were treated during that. We have a strike force established, and they will continue to investigate and chase down every individual that we can identify will be either arrested and or given tickets for their behaviour. And it's not just about whether it's an unauthorised protest, it was about the danger that they put all of us at in terms of the Delta variants. There are some discussions, there's some information on the internet at the moment about a potential protest this Saturday. Can I just put this warning out now to everyone, is that we will be heavily policed. We will be taking the ground very early. You will be arrested and protested. The community has spoken about that behaviour. The Premier has spoken about that behaviour, and it won't be tolerated again. Thank you.
Dr. Chan, you spoke last week about having a mass vaccination push for under 40s in the working population in southwestern Sydney with the Pfizer vaccine. Are you still pursuing that under 40s working population vaccine push with Pfizer, or are you asking them to get AstraZeneca?
So look, obviously we, as I've said, I see vaccination as part of a complementary strategy to a really tight lockdown. And also another element of the strategy is to work with the community. Can I just say how proud I am of the communities of southwestern Sydney who have really been working so hard, and I think that there's room for us to even support them further. In terms of your question, James, about vaccination, we've been looking at which are the groups that are driving the outbreak in terms of transmission. And what's been interesting is the young profile, and it makes sense. The only people that are actually moving about are those essential workers. So people that are working in logistics and distribution, critical workers that come from that area that support Sydney and even New South Wales and beyond. So it is important that we consider how vaccinating that group would potentially prevent transmission. And we're also thinking about everything. So I think it's important to know that we are leaving no stone unturned in terms of how to recalibrate our vaccine strategy to actually have a much more targeted focus on the communities of southwestern Sydney and understand best how to use the available vaccine, noting that there is no supply constraints around AstraZeneca. And as I've indicated, it's a very effective vaccine. And I can't stress it enough. I've been vaccinated, my mother-in-law's been vaccinated, my husband's been vaccinated with AstraZeneca. And I wouldn't do that if I didn't believe it being a good vaccine. And I do urge everyone to take up the opportunity because that's less scarce supply. In terms of Pfizer, I'm very happy that we look at how the Pfizer can be used to have the greatest impact and what categories of staff. So the two sort of areas we're seeing transmission happen in is workplaces, critical workplaces, and households.
And in relation to your tight lockdown that you're talking about, is it your view that that tight lockdown will need to be in place until we get down to zero or as close to zero cases in the community, or 80% of people vaccinated?
The Premier indicated that those discussions are ongoing about the path before, but I think what we've learned is with the Delta variant, you don't have much leeway. It is such a highly infectious strain of the virus, and because we're tackling an issue that whenever we get to a case in a family, the family's already been infected, or inevitably over the next couple of days will become positive. So it has no grace. With the previous strains, we could get to people early enough. And so I think with that challenge, we need to ensure that our approach aligns with that.
Vaccination, Dr. Chan, if I can just ask.
Yes, certainly.
You've got kind of a captive audience with those workers having to go get tested every 3 days, a lot of them at the Fairfield Showground and so forth. Could you not vaccinate them with AstraZeneca at the same location? Could you not set up several locations like Belmore Oval, etc., and kill two birds with one stone?
Look, I think, as I said, we're looking at all options. It's important that we don't mix our testing where people, there'll be a mix of people going for testing. Some people will have symptoms and some people won't. So obviously we've just got to make sure that we don't pose a risk of infectious people, but all avenues, and I think you make a really good point that we're really focused on workers that are particularly mobile and particularly having to provide that critical infrastructure. And as I said, I would encourage everyone to take up any opportunity to get vaccinated.
Dr. Chen, on the AstraZeneca vaccine, can you confirm if pregnant and breastfeeding women can safely get AstraZeneca, or should they insist on Pfizer?
I'll have to check the latest updated advice because I know ATAGI, but I'll get back to you on that. But I know that Pfizer, the College of Obstetricians, has come out with advice about the Pfizer, which has been supported by ATAGI.
Premier. They're prioritised, but they're still not going to be able to get a booking until October to get the vaccine. Do you know why that is, and what's your advice to them? If
Sorry, which group was that?
pregnant women, as a result of being made eligible, now gone to make bookings over the weekend and being told they can't get in until October?
I think we have to accept that there is a scarcity of supply of Pfizer. We do not have unlimited supply, and what we've actually got to do is look at how we can best use the available Pfizer supply to both bring disease burden down, stop transmission and spread, and also how we can protect the most vulnerable in our communities. So unfortunately, we are not in a situation where we have plentiful supplies. There actually wouldn't be any constraint on us vaccinating many people. Our mass vaccination clinics, our GP network, our pharmacy network has incredible capacity that we could turn on very large-scale vaccination. I think if we turned our mind to it, we could do, my colleague who runs the program would put a hair, but I think, I would even challenge, Premier, that we could do more. If we turned all our resources, so I think that we could well have a very rapid push of well over 350,000 just ourselves if we had the opportunity to do so. So really it is about supply constraint of the Pfizer vaccine.
Premier, can I ask the Prime Minister, Premier, the Prime Minister...
Pfizer, so you're not cancelling existing appointments. Are you rescheduling existing ones?
At the moment, we need to say that we are looking, this is what we're looking totally at. We're looking at how is it best to use the available supply of vaccine to have the best impact to help the community. Now, obviously, there are priority groups, some of which are the responsibility of the Commonwealth, such as disability and aged care, that we want to make sure are absolutely vaccinated. We want to protect aged care facilities and disability settings from COVID transmission. We want to make sure that critical health workers that are yet to take up the vaccine are vaccinated. We also need to turn our mind to those with underlying health conditions and also those that might be driving the transmission chains. So we have to make really hard choices, and what we're doing is looking at the best available evidence to look at available supply. But ultimately, if we had more vaccine, we could do more. But we do have a good vaccine, which is AstraZeneca. And as I've said, we've used that. I would just urge you to get vaccinated and take up the opportunity for accessing AstraZeneca. It is actually quite distressing when I've reviewed the numbers to see how few over even 60-year-olds and over 70-year-olds we have managed to reach. And for me, anyone who is over 60 or over 70 should be going to their doctor as a matter of urgency, or their pharmacist, which will be opening up across the state in coming days, and get a dose of vaccine. And please keep yourself safe. It does take vaccines are not a short-term solution. You don't see any effect for about 2 to 3 weeks after, more like 3 weeks, but they are part of a complementary strategy to a very tight lockdown and working with impacted communities to really be part of the solution.
Does that mean, though, given that we are relying on the younger age groups to have AstraZeneca, essentially because of the supply issues, we need them to do that. Does that mean, though, that our lockdown cannot lift in any kind of major way until we've got those younger people done?
I think that we need to say that lockdowns require patience, and I was really distressed to hear the protest. I just can't understand the motivation at such a time. I mean, every day I look at the data on the number of hospitalisations and the numbers of deaths and the number of young people that are impacted and the number of people that are impacted in the communities in which I worked and lived for much of my life. And it actually is quite distressing. So I think we all have a collective responsibility to take up vaccination. We have had the opportunity to get an AstraZeneca shot for a long time. And what I'm urging the community is to play their part, protect themselves, protect their loved ones, and take up the opportunity. And we will have a plan for how we can use available Pfizer doses in the best way possible to protect the health of the community.
Workers, as you say, where we're seeing a lot of these cases, they will be going to work to perform their service no matter whether we're having a lockdown or not. So it seems that, I mean, we really need to see vaccinations in those groups. And I'm wondering, would you be asking employers to mandate that those workers get vaccinated?
Look, I think that we've been working closely with industry groups, and I think, to be fair, there's not a lot of resistance in the community to vaccination. I mean, we have a very supportive community of vaccination. I think it's sometimes about making access easy and making sure people have the right information. But certainly, we're very keen to provide access to those critical workers that are required to keep Sydney running. And that's what I would also like to just acknowledge, that the people of southwestern Sydney and Western Sydney are the people that keep our city running. They do a lot of the work in distribution centres, food, logistics, transport, and I think we should all reflect on that and do our part by also following the health advice and requirements to stay at home, and also do all we can to support our part in keeping each other safe.
Premier, can I just ask the Prime Minister, Premier, on June...
Sorry, a woman who died, the 38-year-old woman, can you just provide some clarity there? She was not vaccinated, or was she? There's some people close to her suggesting she actually had at least one dose of vaccine.
Look, I'll have to check that. I was unaware that she was vaccinated. The advice I had was that she did not have any underlying health issues, but I will confirm that. I can just say that there will always be cases of people who have been vaccinated that have a poor outcome. But can I just say the data is so clear that if you are vaccinated, and get infected, you are less likely to transmit it to others, and you are very protected with particularly the 2 doses of either of the vaccines from hospitalisation and severe illness. There will always be exceptions, but the evidence is categorical on the effectiveness of the vaccines.
Premier, can I just ask, the Prime Minister on June 23rd said in Parliament, "I commend the New South Wales Premier for the way that she is handling the outbreak in New South Wales, the fact she hasn't gone to lockdown Australia's biggest city." He said that was a positive decision. Yesterday, he said, "The lockdown comes to an end by the lockdown effectively working. There's not an easy way to bring these cases down. The lockdown does that work. The vaccines can provide some assistance, but they are not going to end this lockdown." Can you see the contradiction in those messages? And before the first lockdown, did the Prime Minister encourage you in any way to avoid a lockdown? And in recent days, has the Prime Minister attempted to encourage you in any way to tighten the lockdown?
I think what's really important for the people of New South Wales to know is that the decisions our government takes are based on the best health advice. I learned very early on in this pandemic that the best way to support our citizens, to keep them safe and to allow us to live as freely as possible, is to base all of our decisions on their health advice. But we also know and appreciate that you have to really balance out those strict health measures with keeping society functioning. And that's why it is of concern to us, and why we're addressing the settings around households and workplaces. They are still the 2 places where the virus is continuing.
Can you see the contradiction?
Well,
and has he lobbied you on either front,
no,
or encouraged you on either front?
Can I be honest and say a lot of people have given me a lot of free advice, But the best advice that I will continue to rely on is that of Dr. Chan and her team, the New South Wales health experts. They are the experts, and theirs is the advice which our government bases our decisions and announcements on. Can I make that very clear? And I know it's so easy for people to have a view on these matters, and I don't blame people when you're frustrated, you're stuck at home, you're having to homeschool, or you're laid off work. These are incredibly difficult times, and I know that everybody has an opinion, and I respect that. We live in a democracy.
Does the PM ask you to tighten things, Premier?
But my strong position maintains and remains to base all of our decisions on the health advice. And I just want to thank everybody for their patience, as frustrating as this is. And I know that no matter what decision we took or take, people will say we've gone too hard, we've gone too soft. But what we need to do is make sure that every decision we take has a good effect and that the settings in place are there at the right time. And that's why in the next few days we will continue to look at the existing settings to give people certainty on what life in New South Wales beyond July 31 looks like.
Dan Andrews has said that if you showed him modelling which shows the lockdown is working, he'll give you some Pfizer. Are you planning to enter negotiations with Victoria on that if we're desperate for Pfizer in New South Wales?
Look, Andrew, can I say that National Cabinet made their view very, very clear to me on Friday. I argued my little heart out, but the position of the National Cabinet was very clear. I'm someone who'll always fight for New South Wales, but I'm also someone who'll work with what we have. And what we have is a change in health advice on the AstraZeneca vaccine. So I'm urging, as Dr. Chant has said, for everybody to come forward and get vaccinated. And as Dr. Chant said, we will make sure that we're careful with how we distribute the Pfizer, because Pfizer is in limited supply at the moment. We're expecting more supplies later on. But when it comes to classes of people who, for whatever reason, can't take the AstraZeneca, well, then obviously we'll make sure the Pfizer is provided to them.
There've been reports over the weekend emanating from the federal government that kids may not go back to school until term 4. Can you clarify that?
Look, can I please say, I don't know where that speculation's come from. It's certainly not from the New South Wales government. We are considering all those issues this week, and as soon as we have a response to what life will look like beyond July 31, we'll certainly make that clear. But I appreciate that perhaps one of the challenges during a lockdown is homeschooling. So we're always looking at opportunities there to ease the pressure off our households. And of course, we'll base those decisions on health advice. I also want to give an assurance to Year 12 students that, of course, in particular, we're preoccupied with them and reducing their stress. I know that some schools already, as has been part of the health guidelines, have allowed for practical assessments and practical learnings to happen on the school site, and New South Wales Health and Education have been working very closely with that. So can I assure parents in particular and students that we're looking closely at all those settings. But please know, I know a lot of people like to guess and preempt what the government's announcing, but as I've said before, I will let our public know within hours of the government taking a decision. Please know that's how we've done it. I've not been afraid to hold a press conference when we need to announce our decisions as soon as they come to hand, and I give the public that assurance. You have the right to know, shortly after I have the right to know, what is happening, and I will make sure that is made clear. But please know, we also want to make sure we get the settings right, and there's no doubt that during a lockdown we've observed which settings are having better effect than others and what we can do to support in a targeted way those communities that have higher loads of virus in their community, but also support those communities that perhaps don't. And they're some of the things that we're looking at in the next few days, and we'll obviously provide advice as soon as we can to what life looks like beyond July 31.
Premier, are you suggesting that some settings are going to change then, that we're looking post-Friday that settings will change?
Look, I don't want to rule that out. I mean, some settings might change. We might need to go harder in some areas and release some settings in others. So please know that our government is always looking at the best options we have available. And the options are, as I say, our mission is to allow our citizens to live as safely and as freely as possible. And that's always been our position during the pandemic. And that remains our position, but it has to be based on the best health advice. Look, they haven't demonstrated they work.
Can I ask Dr. Chant, if you had curfews, if you brought in the 10K to 5K, would it have any effect on mobility? Would it have any effect on the virus?
So there's a number of areas that we've identified as hotspot areas, such as the local government areas, and they've got restrictions on staying within those local government areas, either the suburb or the local government area. So there's actually quite a lot of restrictions on people's movements. There's a restriction on travel for recreation, and we do ask people to move locally. And from a public health perspective, we're looking at, we're engaging with a wide range of experts. And again, we're not afraid of putting up a range of options. And I think the key point is we need to make sure we're looking closely at the data to understand how transmission is continuing to occur and how we can work with affected communities. They are the most vibrant communities I think, in New South Wales. And I personally believe that they will show us the way, and we just need to partner with them in a way to support them and to support their communities. They are very strong communities. And I also want to say that we will look at every public health intervention across the world that's been implemented and look at how they could be being done, all the way through to how rapid antigen testing can be used, how we can look at basically everything in terms of the best way to provide support to government in terms of advice on initiatives to get these numbers down.
Dr. Chant, you're talking about that we need a tight lockdown, whereas the Premier's suggesting there might be changes. So which one is it?
I didn't take from anything the Premier had said that she wasn't referring to a tight lockdown. I think she's...
no, you say that we need a tight lockdown.
I totally agree. So the data is showing us we've got too many people infectious in the community. We cannot have more people going into workplaces. We cannot have more transmission events in workplaces, which will then drive further chains of transmission. We need a very, very tight lockdown to get those numbers down. And we also need to do more. And as I said, the more is work very closely in a very supportive way with a community-led model for those affected communities. And also, we need vaccination. So everyone has a role to play in this, and I think it's really important.
Is it time of the essence, speed of the essence? I mean, we seem to wait days for obvious decisions sometimes.
I think the reality is that our latest review of the mobility data for places like Fairfield shows that they've actually very significant impacts. So every day we review the available data from a variety of sources to look at how the impact is happening. And can I just commend the Fairfield people? They really have responded in spades. And so we were happy, that data is publicly available, and I'll leave it for others to comment. But we were pleased with some early data we were seeing. And obviously we just need a couple more days, particularly after the weekend data, to look at.
Sorry, just for Dr. Chan, just before she goes, sorry. Just on the Pfizer second doses. So can I take it from what you said before that basically non-essential people will have their second doses rescheduled? So
no, what I've been very clear about is currently we're looking at the very difficult issue of how best to use our available Pfizer supplies to achieve the best outcomes for the community. And I've got to say that from my perspective, if we have to inconvenience some other members of the community to do that, I would like to apologise ahead of time. But we have to look at how we can use the available doses of Pfizer to best support the outcomes for the community in terms of health outcomes.
Premier, the request for job keepers has been rejected again. Premier, how important
I'll
is
get to both of them, sorry, yeah.
Well, the lockdown in Orange Lane and Cabon end at midnight tomorrow as planned. And further looking up north, has there been any cases of community transmission as a result of that Ballon of infectious person on the flight?
Yeah, in relation to the communities of the Central West, can I thank them for being so obliging during their lockdown. And fortunately to date, I have not been advised of any additional cases, but that will rely on Dr. Chan's health advice in relation to that. But it's looking positive, but again, I'll rely on the health advice. And in relation to that case in Ballina, although there's been sewage detection, I'm not advised of any additional cases.
on JobKeeper, that's been rejected again, the request.
Oh, sorry, I didn't
The
hear.
request for JobKeeper has been rejected again. what do you need in terms of disaster payments increased? What further support? And why not end the uncertainty for the construction industry now? Why wait?
I think it's important for us to convey what life looks like on July 31 in the one go, so that everybody knows what life looks like at that time. In relation to financial support, that will also depend on decisions government takes in the next few days on what life will look like beyond July 31. But please know that we won't allow any section of the community to feel either left behind or feel that they can't cope with the financial stress they're experiencing. Our health crisis that we have has to be matched by economic support, and we've always had that balanced approach in New South Wales, and that won't change. So we are putting people ahead of our budget and people ahead of our economy, and that is really important. But we also have a mind to the future. We have a mind to hoping that our future is one of living as freely as possible while keeping our community safe. And that's why the next few days, I won't pretend the next few days are very critical in our thinking in terms of what life beyond July 31 looks like. And of course, that will also impact on what kind of support we feel we need to give communities.
Premier, do your business grants, the $15,000 cash grants, do they apply to the construction industry, or did it cut off before then?
Oh no, those grants apply to any business who is undergoing that financial stress. We purposely haven't specified industries. We've just said if you're a business who can demonstrate a hurt or a downturn according to those criteria, it doesn't matter what sector you're in. And that's why we've even been very positive about people who may not live in so-called hotspots, who may not live in those areas where they're being locked down, because as you know, there are rules that the National Cabinet, the federal government has set as to who they give assistance to, but we weren't beyond that. We said it doesn't matter where you live or work in New South Wales. If you're going through stress, the New South Wales government will pick up the tab, and we're very serious about that.
Because they were stopped on July 17 and the construction industry didn't get hit until after that.
Well, look, I'll check on that, but the most recent announcements we made, I'm assuming apply to all businesses, but I'll double check that.
Just the cut-off dates, it is, yeah.
I'll check that. Oh, sorry. I'll do mine and then give it to Dr. Chan. Yeah.
Singapore is back into a semi-lockdown. They're recording highest cases in 11 months. If a highly vaccinated place like Singapore is still finding itself in lockdown with the likes of Delta, how can you be so certain that, you know, if we get a fully vaccinated population, we can say goodbye to lockdowns here in New South Wales?
Well, I think your question is an excellent one in that it highlights, and I know it's hard for people to hear this, and they'll probably say, why is she saying that? But I think that puts into context how well we have done, even though we're going through a lot of stress. Places like Singapore with high vaccination rates are still seeing thousands and thousands of cases. So the fact that we've been able to keep the virus at bay to this extent is a positive one. So we know that higher vaccination rates prevent hospitalisation, and they also reduce the rate of transmission. And that is what Dr. Chand has been saying, and it's important for us to know that when you have a strain like Delta, vaccination isn't the only answer, but it's definitely part of the answer, because it helps keep people out of hospital, it helps reduce the spread, and it also allows us to forecast a future where we can live more freely. They'll get to a point in New South Wales and Australia where we won't be counting the number of cases, we'll be counting the number of people in hospital. And higher vaccination rates allow you to do that. But it would be irresponsible for us to take that position now, because our vaccination rates aren't high enough to allow us to accept a higher caseload. And that's why we're in the position we are. But your question highlights that compared to the rest of the world, New South Wales has done well to keep the Delta at bay. But what we want to do is obviously have greater freedoms for our community, and that's why it's important for us to use lockdowns, restrictions, but also vaccine as a way for us to live more freely.
Premier, South Australia has been requested and have permission to stop all international flights coming into Adelaide today and tomorrow. Are we picking up that slack?
No, this is another point. New South Wales has always done its fair share. We continue to do that. So
we're not taking those flights.
No, we were asked to take 1,500 a week, and that's what we're doing. Sorry, you had a question here. I'm sorry.
Business grant, right?
I'm sorry, I didn't hear the first.
On the business grant,
Yeah.
further to Liz's question, for a business to be eligible for this grant, they need to demonstrate a decline in turnover for a minimum 2-week period between 26 June to 17 July. Construction was only shut down on the 19th of July, so they wouldn't have had that downturn on that period. Will you move that
Well,
period
obviously,
to take in
if you haven't had the
construction?
downturn, you don't need the support.
But they've had a downturn now because the only reason they're not eligible is because they weren't shut down until 2 days after
Can I
the
just
cut-off.
make it very clear that if a business has had a downturn, they will be eligible for support, and that is what the New South Wales government has always said. We'll pick up the tab for businesses who demonstrate that they have had a downturn, and that's why the pause for 2 weeks was because we did not want to see, and Dr. Chant kept saying to us, she did not want to see literally tens of thousands and hundreds of thousands of people moving around. And that is why we had to take a pause for a couple of weeks on that sector. But please know that any business who fits the criteria will of course get the support.
Can we confirm that you're comfortable that the Central West lockdown can lift tomorrow night? And does the success of this indicate that a snap 7-day lockdown in the regions is the way to go?
So the purpose of that snap lockdown was just to assess the risk from that particular exposure event. What it confirmed is there was no ongoing transmission associated with that event. Can I thank the community in Orange that actually came out for testing. So I think that strategy is what will be one of the considerations for any future rural detections or cases. But I would also like to acknowledge the work of the regions in trying to keep themselves safe. I mean, it is important that labour is sourced locally, that we reduce the movements of any critical workers from Sydney at this time, and also that anyone moving to the regions adheres to the requirements.
Commissioner Fuller.
Could I ask you about, there's an aged care home in Bankstown that's got a confirmed case, but also people at home are very concerned about the schools. So Riverston School, Lane Cove Public seem to have cases among children. Could you also take us through, we seem to see a higher risk now with Delta and younger people sadly passing away.
Look, I think this is a real concern that whereas with the previous strains we didn't see children impacted, we're seeing a young age cohort impacted down to very young babies. Therefore, that's the basis of why we recommended that school not go back to face-to-face learning. And I would urge anyone, schools are only open for the most essential. And if you can avoid sending children to school, that is an appropriate response. So that is the basis of our advice, that with such levels of community transmission, we could not have face-to-face teaching.
If we got all teachers vaccinated, would you be able to go back to face-to-face learning, or because there's transmission between children, would that not be appropriate?
Look, our single-minded focus at the moment is getting the burden of infectious cases down in the community. We need to break the back of this, and we can do that by a number of ways. One, follow the requirements to stay at home and do not move between households. Even how tempting it is to think, oh, I'm just visiting a friend, just how tempting it is to say, oh, I'll just pop into aunt's. Don't do it. It's incredibly important that we just keep households together. We also need to make sure that we get tested whenever we've got symptoms and we immediately isolate. And I would be advising the whole household to isolate pending a test result, given we know how highly infectious this virus is and how quickly those cycles are occurring. We also need to take the opportunity of getting vaccinated. And I think the Delta strain is a game changer. Can I just say our experience with Delta, and that which is mirroring, and we're learning all the time from experience overseas as well as here, about how quickly the transmission chains get set up. So please, whenever you are out and about, do not be complacent. Also, please, you're only one person from a household is meant to be shopping. That's a public health order. A lot of these orders are really hard to police. I mean, I can't imagine the police knowing which household. So rather than everyone looking at loopholes or areas where they think they can get through, can I just ask the community to think about the implications of their actions, and please just stay at home, minimise your movements outside the house, and take up the opportunity to get vaccinated.
Dr. Chan, in those household settings, in those household transmissions, is it essential workers mainly transmitting to their family members, or is it cases of willful non-compliance in those people? And is the messaging in those communities just simply not working?
Look, I don't think that I think there's a couple of drivers. I don't think that we have a situation where everyone willfully is infecting others. I would not like to portray that at all. I think that sometimes people define what they see as their household as a bit broader. You know, they see their aunts, uncles, the next door neighbour family as sort of almost as safe. And what we're saying is, in the setting of COVID, that's not the case. You can't assume that that's the case. And also, I think it's hard for people to realise that you don't have to be sick to be infectious. And so if people are well, I think people generally think you can't infect each other, but that's not the case. As we know with COVID, you're actually probably most infectious before you've got symptoms. And so for both of these factors means that tackling the Delta variant is particularly challenging. And that's why we need a very tight lockdown and why we also need vaccination. But we also need individual action, you know, and everyone has a part to play in this. And as I said, rather than picking holes in what you can or can't do, everyone understands the principles. Please keep their distance from anyone outside the household.
Commissioner Ford, can I ask you?
Sorry. Just on vaccinations, just since we've had this change in the health advice for AstraZeneca, is it possible to open our state-run hubs to a walk-up system for an AstraZeneca jab?
You've thought ahead. I'll be announcing that tomorrow, that we've got a number of...
You're announcing it now.
Sorry. Well, I'm not going to tell you where, just because at the moment there is some work being done and I don't want it to be swamped just as they're setting it up. But look, there is a massive strategy, and can I just acknowledge my colleagues that have been working so hard over the weekend with their local health districts and community partners to identify sites that may be appropriate for walk-in visits. What are the most vulnerable communities? Which groups in the communities don't have access to the vaccine? And how can we make it easier to get vaccinated? So all of that work has been going day and night over the weekend, and there will be some announcements tomorrow.
Commissioner, can I just ask you a quick one, Commissioner? In regards to this planned second protest, last year there was action in the courts with the BLM protest. Is that possible, or is this a bunch of anarchists who won't respond anyway?
There are no organisers that we can take to the Supreme Court to stop the protests from happening, which means they're a bunch of anarchists, which means in terms of our police response, it will be significant on Saturday if it is planned to go ahead.
On Friday, you called this a national emergency on Friday, Premier.
Sorry, last question, sorry.
On Friday, you called this a national emergency. Do you stand by that description? And if that's the case, it sounds like you're throwing in the towel on asking the states, continuing to ask the states for Pfizer. Are you going to keep going on that?
Look, Dr. Chant and I were simply making the point, when the largest state is facing a serious outbreak, it is an issue of national significance. And that is the point we're making. And the point we're making is that we do need to refocus our energies on the vaccination strategy alongside, not replacing, but alongside the lockdowns and the restrictions that we'll have in place. And that is key. What we're doing is just simply stating the facts, that we've been a state that's managed to hold off all strains of the virus. The Delta is a complete game changer. And when a state that's managed the program well to date is saying, observing how difficult managing Delta is, that it is becoming a national issue, and that's the point we're making. Thank you, everybody. Thanks for today. We'll see you tomorrow. Thank you.
Again.